And we are live.
Welcome everyone to the COVID-19 communityresources.com town hall meeting powered by the Center for Closing the Health Gap. I'm Councilmember Jan Michelle Lemon-Kearney, your moderator. And just to let you know, my co-host, Superstar Tropicana from The Wiz, will be back with us next time. You know, after all the added stress from the pandemic, how do we find our joy and peace? We're going to talk today about tools you can use to navigate this stressful time. We're also going to give you an update about guidelines, what you're supposed to do and not supposed to do after the CDC came down with new rules, because people are a little bit confused about that. So we've got a lot to talk about. First, let me thank the powerhouse behind these town hall meetings, the Center for Closing the Health Gap, and Renee Mahaffey Harris. Thank you so much for all you do to keep our community informed. Also, let's give a shout out to our tech team. Today we have Lauren Harden. She's going to make it all happen. She's going to make sure that we get your questions from the Health Gap's Facebook chat answered by our panelists, and also the questions from the Zoom Q&A. And you can always start entering those questions at any time. Also, just want to remind you that this session is being taped so that it can be shared on other platforms, including YouTube. So just want to remind you about that. Let me introduce our fantastic panelists who are going to help us find our joy and peace amid all of the stress we've been through for the last year. We have psychologist Dr. Ritch Hall, psychologist Dr. Traci King. We have therapist Dr. Calisha Brooks, therapist Tracy Sippel, and we have Dr. Edje. So we are so excited that all of you are here. I'm going to ask each panelist to tell us a little bit about themselves and what they do before we go into the questions. So let's start with Dr. Ritch Hall.
Hello, so yes, I'm Dr. Ritch Hall. I am a psychologist. I work for Miami University primarily in their student counseling service. So that's working with college students, but I also have a private practice called PsychWorks LLC that I started last year in the pandemic. And then I'm also the president of the Cincinnati chapter of the Association of Black Psychologists.
Thank you. Okay, Dr. Traci King.
I am also a clinical psychologist. I am licensed here in Ohio as well as in the Caribbean. I work currently at University of Cincinnati, and like Dr. Hall, have a private practice called Thriving Haven.
All right, thank you. Dr. Calisha Brooks.
Hello, beautiful people. So I am Dr. Calisha Brooks. I have a PhD in counseling psychology. I'm a mental health, I consider myself a mental health activist, right? So I have a business called Soul Care LLC, where I look at holistic intersectional healing, especially as it relates to Black people. And so that's just my passion, my love, and my heart is Black healing.
All right, great. And we're going to talk a lot about healing today, I tell you. Okay, Tracey Sippel. Tracy, you have to unmute.
As if, I'm sorry. Yeah, so I'm a licensed mental health therapist. This is a second career for me. I spent 15 years at P&G in behavioral sciences. And I love helping people get through tough times. You know, I feel it is my calling at around 50. I finally getting into the field that I really enjoy. So yeah, I work at Hyde Park Counseling Professionals, and I also work with our esteemed Renee Mahaffey Harris at the Health Gap.
Fantastic, all right. Okay, Dr. Edje.
Hi there, I'm Edje. I'm an Associate Dean of Graduate Medical Education at the University of Cincinnati. So servant leader of about 700 residents and fellows across all specialties. I'm also a private practicing physician in family medicine, taking care of all age groups. And a Moderna trial participant. This is trial day 244 for me. And I've also had the misfortune of losing family members to COVID. So I've had 4 deaths in my family. So all those perspectives inform what I bring to the table today. Thank you for having me, and thank you to Renee for being an amazing woman and providing the platform, and Jan Michelle for being a great moderator.
Thank you so much. And Dr. Edje actually is a national speaker about COVID and the pandemic and the vaccine. So, thank you so much for joining us. I know your schedule is just jam-packed, and all of you, really, we're so glad you're here. So the first question, I know we already have questions in the chat, but let me ask you this as kind of an overall. So has the COVID-19 pandemic had an impact on mental health? If a few of you could talk a little bit about that.
Yeah, absolutely. In my practice, I see a lot of people really trying to navigate what life is like in seclusion. Relationships they haven't been able to nurture the way they traditionally have. Social media in this whirlwind, other people having fun and I'm sitting at home, kind of thing. And people, relationships, this pandemic has really taken its toll on people. And it's amazing the faces people have gone through during this time. And then the fear of what does life look like next, in the next couple of months, the next year. How do we get back to normal? Is there a new normal? What is the new normal? So it certainly has changed. And I try to encourage people to really think about the things they love, things that give them peace, the small things rather than the big things, the relationships they can continue to nurture. So yes, it has had a pretty big importance on mental health.
Thank you so much. Would anyone else like to weigh in on that? I'm just trying to set the stage because we're talking about finding joy and peace. And I've just heard a lot of people say that this has been such a scary year. Dr. Edje, you mentioned losing 4 loved ones. I mean, it's been just something we've never experienced before.
I will also say that, so paradoxically, we've also had folks who had anxiety with going to work and being around a lot of people. And so there's a group of folks who have actually found peace in being able to be at home and doing the things that they normally do and having 45 extra minutes in a day that weren't traffic and some of those other stresses. And I think the impact that we're seeing is when we're starting to do reentry. And we're coming up with reentry plans and everything else. And the options of either staying fully remote or a hybrid plan or in person, some of the rationale that I've been hearing from my team has been very interesting. And we've been able to find efficiencies with being at home partly. So the 2 sides of that, clearly the stress of losing family and loved ones and your mourning your normal way of life has had a huge impact on a lot of people.
So much. And then, here's a question. It says, what kinds of stress factors are you hearing about? What kinds of stressors are people talking about? And anyone?
We all started at the same time. Can you all hear me?
Yes.
I work with a lot of university age students. I used to be a therapist at the University of Cincinnati and left right before the pandemic hit. And again, I do a lot of work on social justice, activism, Black healing, that sort of thing. The stress is in the hearing, in the knowing, right? When the pandemic first hit, Black people were dying. Before that, Black people were dying. The pre-existing conditions that exist, the social and racial unjust, and all of these things. And so there's so many stressors. It's hard to just put your finger on one. A lot of my students state that it's just like being Black. It just feels like everything hurts, right? I turn on the TV, it hurts. I have conversations, it hurts. And so just to kind of pinpoint one is really, really challenging. But I'm sure we'll kind of move into more of the conversation as we go forward. A lot right now, and what I'm hearing is I'm just exhausted. Talking about this is exhausting. Finding a way to heal is exhausting. One of my students wrote a poem and the title was, "I'm so woke, I'm tired." And so I really thought that spoke to so much. We need to be informed about everything that's been going on, but it's so overwhelming.
Yes.
And we're just like overstimulated. We're dealing with chronic stress. We're dealing with chronically being overwhelmed. And so it's a lot. It's a whole lot.
Thank you. Dr. Hall, you were commenting too.
I would genuinely echo a lot of what Calisha just said. Particularly with African Americans, there's a lot of feeling overwhelmed, feeling like, feeling in some ways targeted by a lot of the different things that are going on in the media. And then you place on top of that the uncertainty of the pandemic, and getting so much media about how it is affecting us differently just feels as if now all of the systems are coming against particularly young people who have not quite built up that resiliency around their cultural identity, right? They just haven't fully learned how do you navigate in a system that does have some parts against you, but there are some things within your cultural group that does give you resiliency. When they're still developing that identity, it's hard not to feel just constantly beat up by all this information. And so, and the one thing that Calisha didn't say, but a lot of times I'm telling them, you got to get off social media for a while. Like,
yes,
you're too plugged in, and all this information just isn't good for you. And we did not grow up as beings with a 24-hour news cycle. So this is new in the last 20 years, and it's having a negative effect to be constantly fed the bad news. Not to quote The Wiz, but don't bring me no more bad news, right?
No more bad news.
It's bad for you. It really does poison you. It poisons your mind, poisons your attitude.
It really does. I encourage my clients to take a break from social media. Do an experiment, if you will, and take a break and see what it's like. What is your mood? What is your anxiety level? What are you doing instead? Oh my gosh, it's huge.
Right.
The other thing I think with social media is, quite frankly, the pandemic of misinformation is a life death issue, because it is informing people erroneously to make decisions about this life-saving treatment with remdesivir or with the vaccines. And so for me, it's a vessel for good in many situations, but it is also something that I constantly have to sort of deconstruct when patients come in.
Well said. Yeah.
I've got to say that too, because, now that we're trying to encourage people to take the vaccine, now we're fighting all the misinformation about the vaccine. Dr. Edje, you've been out there, giving it the good fight, which, we really appreciate. And it's tough because people keep coming up with, they heard, one thing or another. It's just like early on, we heard about, drinking Clorox, and people were calling in saying, what portion should they mix? And we were like, none. Like, you don't want to drink Clorox, so it'll but people thought they should. And so, it's just, it's crazy.
And, just to kind of speak to that too, because I think that it is important for us to validate people's concerns.
Yes,
absolutely.
It's also important because we've been through hell. We've been through hell, and during the pandemic, our leadership, right? As a country, fed us a lot of this information. And so, when you talk to a group of people, especially a group of people that's been disenfranchised, and now, we're like, okay, we're getting all this information, we're listening to the media, or we're listening to the government, or we're listening to these things. And then as history holds, I think that it's important to say, wow, I totally, completely understand, these concerns and why you would have some reservations. And so I think that that's just important, especially as we go through these places and spaces of grief and trauma. When people don't want to hear things, that's a part of trauma. That's a part
absolutely.
And validating that helps people to say, well, okay, I know I'm feeling overwhelmed and I am a little skeptical of this. Totally valid, totally and completely normal.
And I think back to, there was an article in The Atlantic by Ms. Kendi, who, is the author of How to Be an Anti-Racist. And it was April 14th, and he was still trying to get the message out that Black and brown people were dying at a higher rate than everybody else, and that there was a disproportionate impact. And to think that was 4 months into the pandemic, and we did not have a national narrative on this issue. We knew, and there were local health departments here and there that were reporting that information, but it really was not a national thing. And now it's known, but just the energy of trying to advocate for the obvious, I think was important to validate concerns in the community.
Absolutely.
I was going to say, I think one of the key things is, one, how quickly we're an information heavy culture, but it's, once again, it's not always good information.
Right.
And that for people to change their minds on things, it takes a while because, and I think once again, this is something Calisha was speaking to, is it's an emotional decision. We're not really making these decisions with, it's a logic, there's a logic to it, but it's not always rational, right? And so in trying to advocate for getting people to change, you know, any of us who've tried to get people to change any kind of habit, know it takes a lot to get people to shift habits. You know, I personally, you know, working out and eating right is a struggle at times, right? And so when you're trying to get people to say, oh no, this new thing that's entered your life and has brought with it all this uncertainty that literally day by day, week by week, we were changing our understanding of it. And now we have a better understanding of it. And this is what we think we should do, but we also can't tell you that will solve the global issue. And so it becomes, so invalidating, it's an understanding that this is bigger than us in a lot of ways. And yet we're working on it. We're essentially putting everybody through a scientific trial when we know people don't understand how that process works, that it is, I know something until I know something else. And so you got to just sort of stay with me until I know the full, you know, degree of what's necessary. And I understand why people struggle with that, because it doesn't feel, there's, what are you standing on? It's a very shaky ground.
Right.
I want to respond to that, just because as a Moderna trial participant, there were 30,000 of us in the Moderna trial. There were 44,000 in the Pfizer trial, and so on. And so usually vaccine trials have about 5,000 people. And there is a gap. There was a gap. It's usually about 6 to 8 weeks between the time that all the trial data has come up before information goes to the FDA. And that's to give us that window to see, are there any serious events that come up in the meanwhile? So to answer the question about whether the drug is efficacious, that happened within the span of the trial itself. So we were the ones who put ourselves up to be, quote, guinea pigs. And the subsequent rollout into the public was only because they were safe and efficacious in the trial group. So, you know, a lot of folks are like, I'm just going to wait for another, you know, couple thousand people to get it. Well, we've already got, you know, multiple times the normal number of testing groups. And still yet things have borne true for the efficacy and safety.
Right. Okay, so panel, I'm going to get to some questions in the chat that are coming in from our audience. Dr. King, I'm going to throw this first one to you. The question is, how do you know when you need to see a psychologist or counselor? But Dr. King, I'm going to give you the first stab at that.
So because there's so many different mental illnesses, it's hard to pinpoint one specific symptom. What I usually tell people is, if you notice that it's a change within yourself, that you are not functioning the way that you typically would have, if you are not getting easily able to fall asleep, or your appetite has changed, or you're not as productive at work or even at school, any change that is atypical of you, then that can indicate that it may be a mental health issue.
Okay, that sounds great. Does anyone want to add to that?
Yeah, I often hear people say, well, this is normal stuff. You know, I should be able to do this. And it's not about, should, but you, just like you go to a doctor when you have a cold, our mental health is just as important as our physical health. And why not seek the help, honestly? So that's the challenge I give people. When they come in my office, I congratulate them on giving something else a try, giving something else an opportunity to improve their lives. So I think Dr. Tina did a great job of the symptoms. It's really when your quality of life is difficult to feel, and when your mood is changed, you don't feel like doing things that you love and being around people that you typically want to be around.
Right.
I was going to say, if we don't bring up the word anhedonia or lack of joy in this talk, so anhedonia is the lack of getting joy in things you used to enjoy. So I love movies, date night every Friday night at 9 p.m. with my husband. If I don't want to go to date night, or I just don't want to watch any movies anymore, guess what? There's something that is a red flag. Something's going on.
Yep.
And I was going to ask you, Dr. Hall, because I know you deal a lot with young people. I've heard people, even colleagues, talk about their younger children seem depressed, and even not just teenagers, but even younger than that, especially when the schools were closed. Like, how do we know
Mhm.
when it's just like, come on guys, let's get outside, you'll be fine, or let's go seek some help.
Yeah, so with children, it is looking a little, it could look a little different because kids might not always know to say things are wrong. They're often, you'll hear them talking about the same thing over and over again. If it's a thing that bothers them a lot, they're going to express a lot of fears or doubts about circumstances that before they would have, gladly gone outside. But now it's, is it okay if I go outside? What's outside? I'm going through that right now with my daughter and the cicadas. It's so many questions about cicadas. And when they start just getting stuck on a topic and you're like, no, you're fine. You can go deal with, you can still be outside sometimes. So when they're constantly discussing a subject, they're not doing things that they previously enjoyed. That's always a sign. Not motivated, not as happy as they were before, maybe. Or they are having panic attacks or tantrums. Often that's a sure sign that they are just in a bad place. Easily angry, irritable. Those are the sorts of things that you'll see in children. They might not come up to you and say, I'm feeling depressed. You're going to see it as externalizing behavior. They're going to act out in a way that you just sort of, man, you're a little different than you were a couple of weeks ago. Or and this has been a long process for children. As you mentioned, they haven't been able to be schooled, to be around their peers in the same capacity. They haven't been able to see teachers who might have also been sort of people in their system that helped them to feel levels of self-esteem. None of my kids' teachers, as they were working from home, know who they are in a way that before they saw these people as valuable parts of their life. So they're now limited in a lot of ways in their points of contact. So in that regard, parents, you kind of know your kids to a certain degree. When you start to see them acting differently and you feel like you're talking to them, but you can't quite get through to what the issue is, then maybe it's time to get to a professional who knows how to sort of open them up a little bit more, whom they don't have to worry about. When you're a parent, there's often a level of, they don't want to let you down. They don't want to disappoint you. They don't want to hurt you. So they might be afraid to disclose to you what's going on. But a therapist gets to be an objective third party who, I can tell this person this and they'll just nod along and act as if I'm not the worst person in the world.
Right.
So in many ways, it's valuable to have that. And that same sort of sentiment is for, adults, the people in your life, your friends. You might be afraid to disclose to them some aspect of yourself, but a therapist is a third party who's going to keep it in a vault. And we're not telling anyone. We're not going to go to your job. We're not going to go to your friends or your mother or your pastor. We're just going to say, that was interesting. We can work on this. And then we'll send you back out into the world a little bit lighter, knowing that you got it off your chest.
Yeah, that confidentiality issue is coming up in a question here. The person said, do you offer your services, and this is to everybody, on a confidential basis? I'm afraid that people at my job may find out about my seeking counseling. Seeking counseling still has a stigma, it seems.
Yes,
Any
very
comments?
true.
Confidentiality is the cornerstone of what we do. Like
Absolutely.
To become this, I have to take an ethical test that says I'm going to maintain the confidentiality of my clients. And there are like 17 things that I had to memorize in order to say that I was going to do this right. Now, I don't remember all 17 of those now, but I remember how to do it, right?
You know, it's in the back of your head.
Yeah. If you sit down and let me answer, I'll probably like get through them. Like, okay, double locked drawers, encrypted devices. It's like a bunch of things. So it's taken very seriously, because if you don't come into the room or show up on the screen and feel safe talking to me, then it's genuine. What's the point of it? If you think that the information you're disclosing to me is going to get back to your parents, your pastor, your girlfriend, your wife, whomever, your boyfriend, then it doesn't have the same resonance. It's not going to feel true, and you're not going to be able to really get vulnerable in the way that you need to in the space. So it's the most important thing.
I think it's important to know that our license depends on our level of confidentiality. It is not something that is an option for mental health professionals. We are required by law to hold your confidentiality. I didn't take a job at a place where it was a workplace and they had internal therapy option, and they were like, "Oh, you have to disclose if employees do these 1, 2, 3 things." I was like, "No, I can't work there then," because I need to have my clients understand and they can trust me. And that I am nothing but someone that for them.
Right. Okay, great. Now, kind of related to that, and this is, really specific, but the person says, will my health plan through my work cover the cost of counseling? And I think
Oftentimes it
most
does.
companies do have
Mhm.
counseling covered. That's,
Most,
you would check
yes.
with your HR person, but any other feedback on that?
So I would recommend that they check. Most organizations do offer some health insurance that provides inclusive of counseling services, but that may mean that the provider has to be within network, or there may be an option out of network. So I would definitely check with the organization or the insurance company to verify specifically what are the details related to compensation or coverage.
Okay, that sounds great.
Unfortunately, the payment side is some of the complicated parts of finding a therapist. You might find someone you jive with, but if they're not in your network, then you got to work it out with them. Most of us who work in private practice have an understanding of how to do that conversation. And we often have a sliding scale, so that if it's too exorbitant a fee, it's too much, it's too costly, we'll work with you to figure out what you can afford, to help you get the help you need, or help you find a way to resources that might be sort of cheaper options for you, because that's also one of our ethical responsibilities. We can't just say, oh, this isn't going to work out, you're on your own. We sort of have an obligation to help you get to the support you need.
Okay, excellent. And here's a really good question. Have you seen an increase in domestic violence complaints during the pandemic?
So when Ohio shut down on March 23rd, they actually went down again, paradoxically, because folks were actually shut in with their abusers. And I think it was difficult for them to get the calls out. But in that same space, they were closer together. And so when things started to open back up back in April, then that's when the reality came to the fore.
And my understanding too is that there might have been an increase, because the question was there an increase in complaints? Which, maybe not, but my understanding was there was an increase in actually domestic violence itself. And it's probably because, as Dr. Edje was saying, people are there in the same household, and the person, the victim, might not have the opportunity to get away from the the assailant, to actually report it, which is like really dangerous. So
Yeah. And people also blame themselves and say, well, I was in this space and we're just cut. So he wouldn't have done this, or she wouldn't have done this outside of it. I've seen a lot of first time, actually, not a lot, but enough to make me pause and say, what is it about this that are driving people to be more volatile at home?
right.
And also with child abuse, that would have also, been child abuse was one of the main reporters of child abuse incidents are teachers, unfortunately, right? So they're going to school and they're being observed by a third party who could say, they're looking a little neglected. They're looking as if they've got some bruises. And unfortunately, with teachers not being able to have that same contact with students, with children, there's a lot of cases that are unfortunately going unnoticed. So it's one of those things that I do hope that people will be engaging in more services as we come out of this, because I do know that those needs definitely exist and have been exacerbated by the pandemic.
Right. Which makes me think we need a better system in place. I don't know if, there's a way of, like, for schools to tell students, here's something you can do, or like a number you can call, and here's a code word. I don't know. We hadn't really thought it through, because this hasn't happened to us before. We haven't just shut down the schools, but we're opening up now, and so maybe going forward, that's something we could actually think about.
Well, there are agencies in schools, and schools do have school psychologists, which is different than what I do. But I have worked in the past with an agency called Central Clinic, which is in a lot of Cincinnati public schools, who do have, provide access for students. But once again, that's a matter of the students engaging in those services, them being available in the school system, and things like that make those resources more available in certain areas than in others.
I think Dr. Hall just mentioned, I keep hearing that word, the systems, and there is the systems that exist, and then there's the community that exists. right? And I'm a fan of working outside the systems, and I believe our community is our immunity, and that we need more community-based programs of accountability, of education, of resources, right? Because a student may not feel comfortable, speaking to a school psychologist, but they'll talk to Big Mama, right? And then Big Mama knows what to do, or the steps to take, or the resources to provide and to bring in. And when everything shut down, again, the systems weren't notified, or they didn't have the numbers to resource or to track. But I personally know 3 people that were murdered due to domestic violence during the pandemic. So there are so many epidemics within the pandemic that occurred and that happened. And
very true.
Child abuse, right? And so again, the systems talk, but the community talks. And there are so many things that, exist and is just going into play that the numbers truly do not reflect. And so just to answer that question, yes, it forced all of us, to kind of take a look at the normalized dysfunction that we've been dealing with, not just in the households, but within ourselves. And so for many people that may not have that sense of skills or resilience to deal with these things, you act out, and a lot of times those people that are close to you feel that impact.
Right. And then someone asked here, is there an emergency hotline like a 911 for mental health? I know we can do 211 to get United Way, and they refer people to different agencies, but I don't know that there's any different hotline for mental health. Does anyone have any info about
Yeah, we instruct our clients at my practice to call 911. There is a suicide hotline. There are other agencies out there to address this. But at least 911 will get you, in case, because it's usually when people are in that state, it is an emergency. So how do we address that? And so 911 is our best option.
And
there are some community things that's going into play, and they may be referring to, I know that there are now community-based programs that I think it's in New York right now, where there's a number that you can call, and instead of the police being sent out, a mental health professional is being sent out. So I do know that there are some cities and states that are adopting that. And, Cincinnati, I don't believe it's here as of yet, but there are some laws, some things in play to.
Yeah. I can tell you as a council person, we do have social workers who work with the police department, and they go out on these calls. We did just have one. We've hired 2 more.
Good.
And also there are mobile crisis units through UC Health that actually are called out as well. And so often, they go out, with the police officer. And then when the police officer sees that, there's no danger of, physical harm, then they can leave and the mobile crisis unit takes over.
And when people call 911 too, I'm sorry, Jan Michelle, they can specify that this is a mental health issue.
Yes.
And then if a social worker or someone who's a police officer that's been trained to deal with, mental health challenges. I know that we deal with that a lot at UC, and there will be specialized officers that have been trained that will come out and help us assist with, the crisis situation. So yeah, but my apologies for cutting you off.
No, that's great. Exactly right.
I did want to mention Mental Health Access Point, which is a division of Central Clinic, is a 24-hour helpline. That number is 513-558-8888. Is that enough eights? But I do know that that's an agency that does offer a 24-hour services to help connect people with mental health services in the community. It is a 24-hour crisis line that is pretty well regarded in the community. It isn't the same as 911. You'd be calling because you knew there was a specific mental health issue, but they've been in the city for several of the decades. I can't say exactly, but isn't always as well known outside of like Medicaid circles.
So, we'll make sure that number, that 513-558-8888 gets on the COVID-19 communityresources.com website so that people know. Dr.
Yeah.
I'm sorry, jump right in.
I just want to say that there are so many different community agencies that 911 is a connecting kind of point dialing that and telling them what your number is, then they can direct you to the community resource that's available to deal with any kind of mental health issue, whether it's suicide or domestic violence, etc. So instead of trying to remember all of these numbers, just remember 911.
Okay, all right, that sounds great. Then another question is, do you meet with people in person or do we have to meet over Zoom?
Person, I'm in person. I'm in both actually. It has evolved. So up until September, I was 100% online. And then it was to 50%, 50-50, and then it's 30. So now I probably see about 15 or 20% of my clients online and in office. So there is a protocol. I wipe down beforehand, less now since I'm vaccinated, but also when people are not, I ask that question every time. There are masks in place, particularly when one of us is not vaccinated, but I find while online works fantastic, way better than I thought it would. Some people like being in person. I like being in person. So yeah, most of my practice is in the office these days.
Yeah, it's great to have that option though, isn't it? I mean,
It is.
people want to be in person and some people don't. And if they don't have transportation, it's like, and they have internet, like this is, I mean, I think one thing about this pandemic is we learned there are other options and it's
Yes, revolutionary. I remember being in grad school a couple of years ago, studying mental health, and that it was a topic of controversy. You know, should that be something that we do? And then it wasn't a choice, and we figured out. And I actually saw clients for 6 months online, and we got through their issues. So we made it work. So
I noticed that it really helped break down barriers, right?
Yeah.
So people that would originally, like had some challenges or issues with canceling or not able to make in-person appointments, they were able to be present and, and meet from a car or from, wherever they were. And so I really appreciate, that aspect of there are options. And so now, again, that's a part of those, breaking down those barriers.
Yeah, one of the tenets of family medicine is continuity of care. And so what we found is that people were able to go ahead and feel safe in their homes and still be able to keep up with some of their visits when they ordinarily would have probably stayed home and said, you know what, we'll wait until a little while longer before we make this visit. So it was very helpful. Of course, you have to have it be an appropriate type of visit for it to be a usable one.
And I just want to highlight that telehealth has also helped with stigma of mental illness. Because I would get questions of, will people see me, or do I need to tell my supervisor that I'm going for a session in the middle of the day? Mm-hmm. And so doing the telehealth, someone can literally just go in their car and have their session or go to a quiet place. So it's not as obvious. So it's definitely helped persons seek help without really being overwhelmed by the stigma that's attached to mental illness.
That is wonderful, because we really have to get past the stigma, and it can be worse in the Black community, because I know there's some communities where it's considered perfectly normal and people talk about their therapists all the time, and we don't do that. We just don't do that. So that's something we really need to work on. So I'm really, the fact that Zoom and all these platforms have helped us is a plus. So let me go away from therapy just for a minute, and we can always get back to it. And there are more questions coming in, but what about, if you don't really, you feel like you might not need therapy, you're just kind of stressed, you're going through this pandemic, you're worried about your job, your business, your kids. What kinds of tools can we use every day to de-stress? And also, I'm going to add to that, someone mentioned about the physical impact of stress, like an increased cortisol level. I might have the wrong word. For pregnant women, it causes low birth weight. So can someone also talk about that? The physical impact, and what if it's, just at a point that, how do you just deal with everyday stress?
Yes, there is a physical impact on stuff. It wears on the body. It makes you heavy. You are carrying something more than you should. And it's interesting how anxiety presents itself very differently from individual to individual. It might be shortness of breath. It might be a sense of overwhelming. It might be dread. It might be heart palpitations. It might be, nervousness and fidgety. Crying is another huge symptom it definitely takes its toll. And I hear, and I wonder if Dr. Edje has seen this, but I hear several of my clients come, well, I had these heart palpitations. I went to my doctor. They told me there's nothing wrong with my heart. They told me it's likely stress or anxiety. And then they come to me, and so we know that it has a physical manifestation in the body. And it'll look different for you. So it's hard to tell you what it might look like, but it's a huge array of things. But if it's not you, that's your indicator. If something is different.
Absolutely. And I love being a family physician because we're able we're trained to take care of both the physical and the mental. So when a patient does come in and we've ruled out, there are two things that we always have to think about when we're trying to diagnose a patient. What is the very, very most common thing this could be? And what is the very worst thing this could be? And those bookend any other thoughts that we have in place. And so, I'm ruling out the heart attack, and I'm ruling out all these other things that are happening when they're coming with chest pain and shortness of breath and palpitations. And when all that sort of sieves out and everything is negative, and we've gone a little deeper in and we've come to the conclusion that there is something else going on here. Maybe it's panic, maybe it's generalized anxiety disorder, any number of different things. Then we can go ahead and talk about, getting a counselor involved, doing possibly pharmacotherapy depending upon the patient and their needs. But I think within the context of a good relationship, a lot of that can be managed pretty well. It's when people don't feel connected to their care providers in one way or another, they feel alone as they're navigating their healthcare. That's when we have a compounded effect on everything. So yeah, it's a privilege to be approached to be able to help care for patients, in their mental health states as well.
Okay, and thank you so much, Dr. Edje. And Dr. Hall, you were kind of shaking your head there vigorously, so I felt like you had something to add.
You're on.
Dr. Hall, you're
Talking, and I was muted. My bad. But no, I was going to say that one of the things that we know is that stress is pretty much anything that happens to the body. So we forget that stress can be the good things just as much as it could be the bad things, the things we consider bad. So it could be getting a new job, or it can be losing your job. Both of those things cause a physical and internal and emotional psychological reaction. And that when we think about how we cope with things, how we deal with things, we often have strategies. Some of them we consider what we call maladaptive. They're not good for us. And some of them are adaptive, and we might not be paying attention on either side. And that's one of the things that as therapists, we're often trying to help people. Like, what is the thing that helps you find joy, to bring it back to sort of the point of this, right? You might not know that you like coloring, but you used to do it before, and it can help you kind of tune out a little bit some of the noise in your mind. So adult coloring books were a really big thing not too long ago. So bringing that into your life, right? If I didn't have my afternoon walks for much of this pandemic, yes, I would have been driven absolutely crazy myself, because it was just so hard to feel so cooped up in the house. But to walk the neighborhood got me up, got me out, got me feeling a little bit more active. And my Fitbit was no longer yelling at me all the time for not getting out of my chair. It can often be small things. It doesn't have to be the big things. Sometimes people come and they say, I want skills. And it's like, well, there are probably small things you can add to your everyday life that help you to feel a little bit more connected, a little bit more relaxed, right? I often explain to my clients that you have a reservoir of how much you can take, but you also have a reservoir of what you're doing to help you get through the day. So how do you fill that other reservoir? Because this other reservoir is going to go down no matter what, but you can sort of boost yourself by doing some of these other things. And so it could be as simple as just like Googling what are coping skills activities, and then finding 3 or 4 of those and trying them out. It might say something like, do some painting, or take walks, or, go swimming. Whatever it is that helps you feel a little less on edge can be just a good thing to add to your life.
And it's interesting. It's interesting that most people know what they do. I mean, it's for God, because they're in this love, right? Yeah. They know what they love. So oftentimes, I suggest, what was something that you loved 10 years ago, 5 years ago? Let's get back into what feeds you, replenishes you.
Yeah. The other thing is exercise, of course. And so 150 minutes of exercise per week, mentally and physically, is a wonderful thing to do. Of course, check with your healthcare provider that you're able to do that first, but more than likely you are able to do it. So encourage exercise, release those endorphins.
Yeah, exercise is key. And one thing we can also do is check on each other, because I know that a lot of people who live
Yes.
alone and not able to get out there, and sometimes we forget, these folks are actually living by themselves and they have just no human contact. So we have to check on family and neighbors, and that's really important too. So there's another question in the chat, and it says, I wonder if you have some ideas about how to give each of you more exposure. I've been asked by numerous people over the past 6 months about Black and people of color psychologists and counselors and therapists. It says perhaps the Black Psychologist Organization can assist. So I guess that's a key thing. Here you are, all of you are great resources. How do people find you? Is there a resource?
So one of the things that we are working on with the Association of Black Psychologists is developing a directory that would make it a little bit more easily, because I know I get a lot of people asking me, asking my colleagues, where can I find Black therapists, therapists of color, Black women therapists? I get that one a lot because I'm not a Black woman. So, people come in there like, I'd rather see a woman. And we never take it personally. If I'm not your guide, then let's find you your way to your
Right,
person.
never take personally.
Right, you got to get a tough skin in that regard. So we're working on developing a directory. We're hoping that's my summer project. So we're hoping that we can have something that could be available that'll be a website the community can go to, so that I'm not having to resend out the same list every time. I could just go to this website. It's available to you. And that's we do think that it's important that we sort of get our voices, our faces out there, because a lot of times people have this idea in their head, right? They have a therapist is an old white guy with a plant in his room and a couch, and that feels weird. And it's like, no, it could be a person that looks similar to a person you met before, a person and who could just sort of talk to you about what's going on. It doesn't have to be a big deal.
Right.
And you know what, the NAACP coronavirus hesitancy in Black and Latinx communities had a study done that was back at the beginning of the pandemic, midway through the last year. And it was all about trust. And of course, we know what they did find is that people trust people who look like them, and they trust the healthcare providers. So we've already got a leg up in that space. Certainly, I think, the Health Gap may be a great convener of names as well.
That's great. I was going to say, Lori, Nandiai, and Lori, I probably said your last name wrong, and I apologize, but you're saying, is there a place that lists your professional fortes, areas of preference to address with clients? And so, Dr. Hall, I'm sure as you're developing this directory, it'll give the areas of specialty, right? And
yes,
so,
actually, we find that that's one thing that people want a lot is, are you familiar with women's issues, men's issues? Are you a Christian counselor? A lot of African Americans want someone who's comfortable talking about religion, or may even have expertise in that. So we do plan to, as we develop the directory, to make it sort of have people identify their specialties, what they're comfortable with, what they're good at, so that people can get to the type of person they'd be good with.
that would be great. And, make sure we know about it, because, the COVID-19 communityresources.com and the Closing the Health Gap both would like to have that information. And I know the Health Gap has a list as well. And so those fine. So that would be wonderful. And in a minute, I'm going to ask you all to tell us, and Dr. Edje, well, let me do this now, because I'm going to end by asking, there's a great question here that says, how did each of you describe what inspired you to become a counselor or psychologist? But before we get to that, we promised to give people an update about what the heck are the rules now. The CDC is like, take your mask off when you're inside if you've been vaxxed, if you've been double vaxxed, but keep it on when you're in a nursing home. What do we do? People are so confused. So let's straighten that out, and then we're going to get back to each of you telling us your personal story.
So Rachel Walensky, or Dr. Walensky, who is the director of HHS, Health and Human Services, came out and told us what the CDC's thoughts were on this. And essentially, if you are fully vaccinated, which means that you are 14 days after the second dose of either Pfizer or Moderna, or 14 days after J&J, then you're fully vaccinated, then you do not need to mask. You do not need to do that indoors, outdoors, and you don't need to socially distance. And that was a very broad sweeping piece, again, specifically for vaccinated individuals, fully vaccinated individuals. If you're not fully vaccinated, that does not apply to you. And if you're immunocompromised, where your immune system is not good, that can also be an issue. Again, doesn't apply to you. If you're a child, for example, under age 12 and have not been vaccinated, also doesn't apply. I think there's a lot of controversy, and people have been concerned about, well, how do I know when somebody else has been vaccinated? What we do know is that from studies out of Israel in particular, that transmissibility, which was one of the things we were concerned about in vaccinated patients, it's not transmissible in patients who've been vaccinated. So you're not shedding the virus to be able to affect other people. Again, if you're not vaccinated or you're not fully vaccinated, it doesn't apply to you. And that was a federal level recommendation. State recommendations are different, except for Ohio. Actually, a couple of weeks ago, our governor did go ahead and make those congruous so that they line up together. The other thing is that businesses have every right to go ahead and stick to what they want to as far as their rules. So, keep your mask handy, keep it in their pocket anyway. And again, it's evolving how comfortable people are to be out and about. Within our space, we're still doing 6 feet right now at the university, and we're still doing socially distancing, and we will end up having facial coverings that are not necessary down the line.
Yeah, I was going to say City Hall, you still have to wear a mask to actually get in, which I like. I feel uncomfortable when I'm indoors and people aren't masked up. Even, like I'm not going to ask them whether or not they're actually vaccinated. I just think we shouldn't go too fast. Let's get through this and get done with it. I just want to be done with it. So I don't think we should push it, but that's just my opinion. All right. So Ethel said, what about the people that have been fully vaccinated and they've still gotten the virus? Okay, we've heard that too.
So I actually had them run the numbers for Southeast Ohio a couple days ago. There were 188 people admitted across our region who had COVID, and 0 of them had been vaccinated. So that's one thing. And then the breakthroughs, the people who have been, who have gotten COVID, but they were actually vaccinated, again, had the deficiency of being immunocompromised. So their immune systems weren't up to par. And in particular, 2 of those individuals were transplant patients. So again, the vaccine, the folks who are getting into the hospitals are younger because we've already vaccinated a lot of our older cohort. So younger patients and non-vaccinated patients are the ones that are getting sick enough to be in the hospital and dying.
Okay. All right. Okay. So, we're getting pretty close to the end. So I just love this question. So I'm going to ask each of you to tell us kind of briefly, would you describe who inspired you to become a counselor, psychologist, therapist, doctor? What advice would you give to students who may have an interest in your field? Okay, why don't we start with Dr. King? I'm looking at you across my screen. So
So I grew up in the Caribbean, and in the Caribbean, we don't have a lot of resources with mental health. And when I started college, I wanted to be a genetics engineer, and I ended up taking an intro to psychology class and just fell in love with all aspects of psychology, and recognizing that there's so much that you can do in this field of helping others and contributing to the world. And so that's been my passion. I continue to hold that passion years later, even after grad school, and just love working with communities and in creating and being a part of initiatives that makes other person's lives better and makes the world better in general.
wonderful. Okay, Dr. Hall, you're next. at least
Yeah.
on my screen. So
Yes. So I think the 6th grade, I wanted to be a psychologist because I found out that I could have my own office, and at the time I thought I could make my own schedule. And I was a good listener. So people always said, you got a good therapist vibe going. And I was like, okay, then sure. Great job. Makes a lot of money and I'll have my own office. And then my parents really wanted me to be a doctor, but they meant medical doctor. So, but I could not pass chemistry to save my life. So but I did find psychology courses I was always good at. Psychology courses I got always got high marks. I loved, I could never understand people. People are not always who we say we are. And psychology helped me to understand why we're not who we say we are. So met other Black psychologists and immediately felt this kinship with them, and I could be that. This is genuinely a thing. And so when I talk to young people about this, it's, one, we are out here. We're a little tough to find. You have to be intentional about finding us. But you'll often find when you meet one of us in person, we're actually normal people. And so sometimes just getting exposure to us through some of the things we do, either in the community. That's one of the reasons that I like doing things like this and other things, so that I'm out there so that people see I'm just a normal person whom you could also be like if you just want to go do a bunch of school.
great. That's wonderful.
And just find those connections, because a lot of us are often very interested in mentorship because we know how few of us there are out there. So if you reach out to us, we'll often be very glad to just tell you the pathway and to be there for, there's quite a few people I've been there with from the beginning, from undergrad to now graduate school to, I've got a couple of psychology babies out there that I'm actually super excited that they're in the field now because I was willing to just sort of, hey, how you doing? You still in the game? Let's get there because there are so few of us.
All right, thank you so much. And Tracy, you kind of told us your story. Do you want to add anything to it real quickly?
Yeah, I've always
Tracy.
been interested in it. I took a course in undergrad, I don't know, eons ago, 30 years ago. And I thought, wow, and I thought, oh, it requires me to go to school for 8 years now. So, so I decided to switch. And then when I was, my mid 40s, I'm thinking there's something more I want to do. And, actually being a Girl Scout troop leader, honestly, just seeing the pain and the confusion, dealing with the moms and the kids and sometimes the dads. And I felt that, finally I might be good at it. So I decided to give it around to at least, take a couple of courses and see. And then I just flew through the program because I just couldn't get to it fast enough. And I really love what I do. I can say that for the first time in my life.
I can tell. Okay, how did you get into medicine?
Is it me? Oh, Dr.
Okay, Calisha, you jumped in, you go right ahead.
No, I didn't know what you said. You cut out, so I didn't know.
No.
Quick, because I know time is of the essence. I consider myself a hood chick with a PhD. I grew up in the inner city. I grew up in the hood, and growing up in those places and spaces, you see a lot, you hear a lot, you experience a lot. And I've always wanted to know the why, right? And there was no words, I didn't have psychologists in my vocabulary. I didn't know what one was. I never saw anyone going to therapy, but I knew I had this gift and this need to always know the why and to help heal. So I feel like I've always been a healer for a long time. And it wasn't until I went to FISC, that's why I'm so pro HBCUs, and I found my mentor there, and she was a Black female psychologist. And I absolutely loved her. And when we had a connection, and I realized that is what I want to do. That is who I want to be. And it was a full circle moment to have one of my students, a high school student, point me out and said, you are what I want to be. You are what I want to do. And I was like, wow, that sense of exposure in them seeing us and them hearing us and being, experiencing who we are and what we do. And like Dr. Hall said, we are people. We are regular people who are connected, and so we're maybe a couple of steps ahead and may have some more experience, but we're human first before we're anything. So
I love it. Thank you. You're awesome. Okay, Dr. Edje, how did you end up in medicine? And we have a minute left, and then Renee's going to jump on to close us out. So just
yes. When I was a kid, I wanted to know why red drinks came out yellow. That was what got me interested in physiology in the first place. But then I became a family physician mainly because of 4 things. I love continuity of care. I like developing those relationships. I've been a doc since 1990. 5. And so that was one. Secondly, I wanted to make sure that we had first contact care. I love being the first person that a sick individual sees to help out with their care. Coordinated care. So I'm working with a lot of my specialist colleagues in this collegial relationships. And then the other thing is making sure that we have a very continuity, as I previously mentioned, but encompassing around all that is community. And I think that working with the community is what we're doing right now. It's what I love.
That is great. I have to say, you all
I'm
are
going
also-
to jump in and close this out so that we can stay mindful to time. First of all, I want to thank all of you, Dr. Edje, King, Hall, Brooks, Sippel, and our council member, Jan Michelle Lemon-Kearney. You have helped our community understand what we still yet need, and that means we need to be connected to the resources to help us be the best that we can be and that all that God intends us to be. So I thank you all for being here. I thank you for joining in today's town hall, and look forward to our continued collaboration to make sure that we make it easy for our communities to gain access to the tools through our therapists, our psychologists, our counselors in this community, and of course our family physician. And so thank you all. You all have a blessed weekend, and thank you for being a part of helping our community be better, because we must work together to save us. So thank you.
Yes,
Thank
thank you
you.
for having us. Yes.
You're
Thanks for
awesome.
having us.
Okay, great. Thank you so much.